In the U.S., about 40 million people are missing all of their teeth, and it's more prevalent among seniors. Wearing dentures is tough, especially when you don't have enough bone to even hold them. So what other options do you have? The most modern and effective treatments require an expert with extra training and experience to help you get beautiful and functional teeth. Dr. Ali Obeidi with Elite Dental Solutions does everything under one roof to help you control cost and get the best quality. Dr. O, as we call him, joins us again with part of a series on educating us about dental health. His patient, Maria Flores, struggled with teeth trouble for over 50 years before getting the smile she's always dreamed of, thanks to Dr. O, and she's joined by her husband, Roberto. Good morning.
Good morning, Deborah. Thank you for having me again.
Absolutely. Wow. Those staggering numbers at the top, 40 million people missing all their teeth, and then so many more people missing at least one tooth. But that's why it is so important, the way that technology changes today, to see a specialist, not just a regular dental office. A dentist is not just a dentist, is not just a dentist.
Yes. You know, Deborah, going to medical specialists is very common with people. God forbid if you break a leg or need a hip replacement, automatically you go to orthopedic surgeon. Mm-hmm. You have a heart problem, you go to a cardiologist, or got a cancer, you go to an oncologist. But a lot of people, when it comes to oral health, they do not aware that we have 12 different dental specialties in the field. As a prosthodontist, we celebrate the last week of April as a National Prosthodontics Awareness Week.
Ah, there you go, right there. You got the sign with you right here. Yeah, there you go.
Yes, yeah. National Prosthodontics Awareness Week is every year celebrated in the end of April. And as a prosthodontist, I want to let every one of your audience knows that prosthodontics is a specialty in dentistry. We focus on teeth loss management, including dental implants, complex cases, full mouth rehabilitations, and basically more complex treatments.
Yeah, which means it's
people
more education.
More education, yes.
Yeah.
One of the aspects of my practice is patients that refer to me by their general dentist or family and friends. But the other one is the patients that are coming to my practice for second opinion. Mm-hmm. People are getting treatments done in other places that are not started very well. Mm-hmm. The treatment plan didn't go the way they expected. The results are not the way they wanted.
And for many, they were told, "I'm sorry, you don't have enough bone. We can't do anything."
Yes,
well, you can do
sometimes. Yes, exactly. Sometimes the results are not the way they want, right. And they are frustrated. Today, Maria is here as an example. Yeah. She's going to share her story with us, and she's volunteered, actually. She's volunteered to share her story with us.
Because she's so happy with what you did. Oh, yes. I mean, because Maria, over 50 years of dental issues. First of all, what's up with these ages today? I'm like, aren't you just 50? but no. I will say, it started for you early. This whole impact on your teeth did start for you early.
Yes, actually impacted from age 1. When I was diagnosed with asthma, and I went through a lot of medical treatments that led me to losing almost 70% of my upper teeth.
And you were only 15 at that time?
15,
oh,
yes ma'am.
Wow, okay. You got bridges, you got crowns, you got partials, and all those things are kind of temporary, and you always had to be careful about what you ate?
Exactly. Very careful when you eat, the things that you eat are always important, and where are you eating, because you are always afraid of, breaking a tooth, or I don't know, anything else, you name it.
Even though you had strict dental hygiene, which we all think, if as long as you brush and you floss, everything should go perfectly well. You did everything right, but still there were issues. You had dentures at a young age too.
Yes, that's right. Even though you floss, sometimes you wash your teeth and you have a very strict oral hygiene, sometimes also depends on medications that you take, and That is very important. That really made me very frustrated, because no matter how hard I tried, I always ended up having issues with my teeth.
Yeah, and the dentures wouldn't fit right,
Yes,
and those
ma'am.
could come out as well. So you were determined to try to find an answer. And to Dr. O's point earlier, it's important to find the right answer. You found one dentist for implants. He pulled all your remaining teeth, and then what happened?
Right, that became the worst nightmare of my life, because after the initial surgery, he disappeared. You know, I never saw him again.
And you were dealing with assistants, or almost
I was
right
dealing,
after?
yes, after in every appointment that I had after the surgery, I was just held by the assistants, and they never delivered the right product, because they had promised me to, you know, to have a great final.
Yeah, he assured you, oh, you're going to be fine.
And everything. Oh,
Yeah.
no, don't worry, Maria, you're never going to have any problem again.
So it's just so tough to go to a big impact on your self-esteem, a big impact on your health. And so your husband kind of went through this wave with you. What was it like watching her struggle like this? And how did you see it impact her personality?
Well, the thing is, from that perspective, the time that it took for this whole process to finally find a final solution, we're talking about a year.
Yeah.
And they adjusted, and sometimes we were eating, and all of a sudden a screw would fall out.
Oh, yikes.
And then all of a sudden, at the next appointment, they will give her another temporary denture.
Yes, that's
And
right.
that denture, by the time we got home, it would break. A tooth would fell out.
Yes.
So it was a very difficult period to go through.
Yeah, that is crazy. You cried and you prayed, and here came Dr. O, right?
Yes, ma'am.
And finding relief. And when you walked in the door, you knew things were different.
Oh, definitely. The thing is that my husband just made something to mention that it was very hard for me to deal with. It was the fact that I wasn't able to eat in front of anybody, because every time I ate, you know, a lot of food got stuck in between my teeth.
Yeah.
So it was very embarrassing, and also an open door for infections.
Yeah.
So I was really frustrated. So by the time I found Dr. Obeidi, immediately I was able to trust his abilities, his expertise, and most of all, you know, like a very honest man.
Yeah.
So he promised to restore my mouth, and yes, surely enough, after 2 months, I had a new mouth, a new smile, in a new life.
Yeah, and literally a new life. Okay, so this is to your point. You know, complex problems especially need to be in expert hands. What was going on in her mouth?
She got she had so much problem to begin with, so she needed a better planning from the get-go. Some of the implants that were placed for her were not at the right place. And also, she needed actually full mouth reconstruction. She had good teeth on the bottom that she could keep. Some people, you know, you go somewhere and they have a set of treatment for you. They say, okay, we're gonna take your teeth out, we're gonna give you implants. That's exactly what we do. In our practice, we take care of you as a human being, as an individual with different conditions, and everyone is different.
Yeah.
So we custom made the treatment for you. So for her lower teeth were perfectly fine, so we could save them for her, and I made them right and adjust the top based on existing bottom that she had. Now the results is promising. Sometimes I can help people. Sometimes it's gone to a point that either limit my ability to correct it. Sometimes can
Which is
help
why
it.
if you can get in sooner the better, right? And you also, as you mentioned, you customize it to each patient. So you can replace one bad tooth if that's the issue, but if it's the entire mouth that you have to work with, you can do that as well. And we're seeing these really dramatic pictures that make all the difference in the world. For dramatic treatment like this, what's the cost? Because sometimes people, even though what they get in return is priceless, and I'm sure, Maria, you would say all the stuff you spent before, if you had just known to come to the right person first.
Exactly.
But basically what you get in return is priceless. So what are we talking about price-wise?
Yeah, so basically this treatment is no more a treatment only available to wealthy people. It's not that expensive anymore. The full mouth, full arch implant treatment runs about $25,000 to $30,000 nationally. But in my practice, our team helps people with third-party financing. First of all, you get a special price because you're seeing the show. The second is that if you can save a cup of coffee a day, less than $8 a day, you can have a full arch of dental implant
with a monthly payment.
With a monthly payment, yes, third party finance.
Yeah. All right, Roberto, how have you seen your wife change since having this new smile?
Wow, it's a tremendous change because she has undergone so many other obstacles in her life and always has overcome all of them. And thanks to our belief in God, we believe very strongly, and that's one of the main factors. But yes, a total change.
You got yourself a new woman. All right.
Yes, I want to tell that these are regular people, are ordinary people. Both of them are teachers. We appreciate what you do. So they are not necessarily rich people. They are ordinary people that they could get that. Unfortunately, Maria got the treatment started somewhere else, and she needed to even pay more because because of the cost. But if you started right, you can pay less.
Yeah, all right. Thinking about getting dental implants, teeth in a day, or all on one for treatment? Did you get a quote from a national brand? Before you do anything, Elite Dental Specialist and Dr. O want the chance to make a difference in your life and make sure it's done right. He has an exclusive offer for Great Day Houston viewers. Call now to receive a complimentary one-on-one consultation with Dr. O, which includes assessments and 3D cone beam radiography. The consult fee and 3D X-ray are a $450 value, but it would be complimentary if you call now. In addition, bring your quote and save up to 20% off that price. You must mention Great Day Houston to receive this offer. Call Elite Dental Specialist at 346-603-5847. Again, that number is 346-603-5847 to secure your spot now. And for more information, visit their website at elitedentalspecialist.com, elitedentalspecialist.com.